The lone clinic in Grenada that treats dialysis patients has issued letters to its clients stating that due to the difficulty in receiving contributions from the Patient Kidney Foundation and the government for services in March and April 2020, effective immediately, no treatment can be rendered unless paid in full on or before the day of each treatment. Dated Monday, May 4th, the letter states that each treatment will cost EC $695 and bears the letterhead of the clinic, Island Health Services, which is owned by Trevor Forrester, son of opposition politician Terence Forrester. On Wednesday, Minister of Health, Honorable Nickolas Steel, explained that the co-payment plan requires that government's contributions are paid to the Kidney Foundation, which then provides the payment to the clinic. But the COVID-19 regulations caused a delay in the process.
I spoke to the Kidney Foundation, and their explanation simply was because we were on 3-day lockdowns or 2-day lockdowns, that they had some delays, that they also communicated with the service provider to say that they may be late in payments, but rest assured they will be making payments to the service provider. Because their thrift shop as well, which is a main source of income for them, has been closed.
Minister Steel acknowledged that prior to this, there has been constant communication between the ministry and management of the clinic, including in March when government helped IHS get supplies from Trinidad to Grenada via an RSS aircraft and facilitated clearing of supplies the following week.
I would have thought that if he hadn't received payments based on the fact that his lives at stake, that he would have communicated to the Ministry of Health to find out or to confirm, or to the Kidney Foundation. As far as I'm aware, none of that was done, and just a simple communication to the patients, threatening them basically that if they don't pay, they won't receive service. So I think that is truly unacceptable. As I said, I can confirm that government has been making its payments, that quite likely under the circumstances like everything else, there are delays in getting those payments to the service provider, which is reasonable under these circumstances. And I think any reasonable individual, especially providing that type of service, would have gone the extra distance as well to simply communicate, to make a phone call.
The health minister says most evident from the situation is that energies now, as best as possible, must be diverted once more to the establishment of a government-run dialysis clinic at the General Hospital.
Because we cannot allow this situation to continue. And we have to have responsible service for our dialysis patients. And as such, government has to make sure that we have that service available under the control of government.
In a response posted on their Facebook page on Tuesday night, Island Health Services stated that the decision taken was unavoidable since the institution has financial obligations of their own to their suppliers. The clinic says 90% of its medical supply comes from the United States and requires upfront payment. And with the absence of payment for 2 months, the cash flow situation could not continue for much longer. They said they had to make an adjustment for the interim period in order to protect their medical supply chain and stay open for their now 18 patients. Blossom Alexis Welsh, GBN News.